Your Excellency, Mr. President, Dr. Tedros, Your Excellencies representing the missions in Geneva, ladies and gentlemen, welcome to this World No Tobacco Day celebration event. Thank you very much for taking time in the middle of the day to join us, and we're very honored to have our special guest, His Excellency the President of Uruguay, along with a distinguished panel joining us. And we will move quickly to the items on the agenda, starting with this year's World No Tobacco Day video. Lights, please.
Do you know tobacco causes over 1 in 10 heart disease deaths, and breathing secondhand smoke causes strokes and heart attacks? No? Well, you are not alone. Hundreds of millions of tobacco users are unaware that tobacco causes heart disease. But now, you do. Protect your heart and choose health, not tobacco.
Thank you. My name is Joel Schaefer, and I will be here simply to keep the program moving. We will have a series of speakers representing different perspectives on the issue of tobacco, and this year, in line with the theme, its link to cardiovascular diseases. And we will also have time for your questions and some discussion of our distinguished panel. First, I would like to invite Dr. Tedros for your opening remarks, please. And the podium is just back to your left.
So is it already good afternoon, or? Your Excellency, Dr. Vázquez, President of Uruguay, my dear brother, and distinguished guests, colleagues, ladies and gentlemen, welcome to WHO. It's a real honor to have you here, President Vázquez. I keep saying that we need political commitment at the highest levels to make real progress in health. And His Excellency is the perfect example of what I mean. I repeat, His Excellency is the perfect example of what I mean by political commitment at the highest level possible. We first met here in Geneva almost a year ago, as you remember. And I was pleased to see you again at the meeting on NCDs in Montevideo in October, where I felt at home. And the hospitality was great. And personally, the hospitality that was extended from you. And your support has just been incredible and exceptional. So I want to come back to Montevideo, by the way. And ladies and gentlemen, this is a year of big anniversaries. It's the 70th birthday of WHO, the 40th anniversary of the Alma-Ata Declaration on Primary Care, and the 100th anniversary of the Spanish flu epidemic or pandemic. It's also the 30th birthday of World No Tobacco Day, which was agreed by the World Health Assembly in 1988. Many people know that tobacco use causes cancer, but many people are not aware that tobacco also causes heart attacks and strokes, which are the world's leading cause of death. Tobacco breaks hearts, quite literally. That's why we have chosen cardiovascular disease as a theme for World No Tobacco Day this year. Tobacco kills more than 7 million people each year, and almost half of those deaths are from heart disease and stroke. Tobacco is one of the greatest public health threats the world has ever faced. The Spanish flu pandemic 100 years ago killed an estimated 50 million people, and tobacco is like a Spanish flu pandemic every 7 years. If tobacco was a virus, the world would invest billions of dollars to develop vaccines to prevent it and medicines to cure it. But because it's a multi-billion-dollar industry, many governments turn a blind eye. The Sustainable Development Goals set a target for reducing premature mortality from non-communicable diseases by 1/3 by 2030. Dramatically reducing tobacco use globally is a central pillar for achieving that target. Today, WHO is releasing a new report that shows that over half of countries are making progress towards reducing tobacco use, but more needs to be done. There are over 1.1 billion people in the world using tobacco products today. And if current trends continue, we will miss our goals and targets. But it should not be that way, because we know exactly what to do. Banning tobacco marketing and smoking in public places to make it harder to smoke, raising tobacco taxes to reduce consumption and generate revenues for health systems, and stopping the illegal trade of tobacco to reduce the availability of cheap tobacco products, fight crime, and protect government tax revenues. That's why the protocol to eliminate illicit trade in tobacco products is such an important tool. We need 5 more countries to ratify the protocol, and I'm pleased to say that Uruguay was actually the second country to ratify it. Nicaragua was the first. Indeed, Uruguay has led by example for many years. In 2005, it introduced health warnings on tobacco packs. This and other measures have helped to reduce smoking prevalence by 13% since 2009. In fact, they were so successful that Philip Morris International sued Uruguay in an international court for damaging its trademarks and investments. In 2016, Uruguay won, and the court ordered Philip Morris to pay Uruguay's costs. This was a major victory not only for Uruguay, but for the regulation of other harmful commodities around the world. Under the leadership of President Vázquez, Uruguay has become a hero in the fight against tobacco. Today, I have the greatest honor of awarding His Excellency President Dr. Tabaré Ramón Vázquez, President of Uruguay, the Director General Special Recognition Award of Contribution to Global Tobacco Control in appreciation of his strong leadership. Your Excellency, thank you for your efforts to protect the health of your people and for the example you have set for the world, for the whole world. I salute you. And please join me in congratulating President Tabaré Vázquez and share with me my greatest respect and appreciation for your leadership. Muchas gracias, hermano. Thank you. Thank you.
Thank you, Dr. Tedros. It is now my pleasure to invite Dr. Tabaré Ramón Vázquez, President of the Oriental Republic of Uruguay, to address the Assembly.
Muy buenos días.
Good morning to all of you. It is truly an honor to be here. Dr. Tedros hardly needs to be invited to come to Uruguay. He will always be welcome, as will the rest of you. Uruguayans very much like guests, but more than that, we appreciate repeated guests. So there is a standing invitation to our small country, which is in the south. Montevideo is the capital city, which is the furthest south on the planet. We are far away from many important centers of power in the world. But Uruguay is very much willing, within its means, to modestly join the struggle against the most horrendous scourges that humanity is facing. And that being said, I am not trying to dramatize the situation. I am simply being realistic in my assessment. Dear friends, one cannot expect prizes, but when they are given, you have to be truly thankful. Thus, at the outset, I would like to thank all of you for inviting me to participate in this event. The warm hospitality that you have shown and this award that you are honoring me with. I accept it as a personal recognition, but mostly I accept it on behalf of all of those who helped me to deserve it. There are many people. Most of them work tirelessly in the shadows, but all of them are in my heart, and I feel like they are here today with me at this time. Any award is an honor, but also I am committed to show that this honor is deserved, and I think the best way to be up to the standard required for this prize is to continue policies, programs, and actions so that every day will be a no tobacco day throughout the world. A no tobacco day for humanity forever. I realize that this statement may seem like hyperbole. Perhaps it is too lofty of an aim. But let us ask ourselves, would it not be wonderful to achieve this, and isn't it worth fighting for? Should we not at least make the effort? I think that it is worthwhile, and I'm sure that all of you think the same. For this reason, and also because prizes are not just to be framed and put up on a wall, and this is not a final point. When I accept this distinction, I am committing to continue working to deal with this scourge. But you can make the best laws, the best presidential decrees, but if you do not achieve political consensus, and even more so social commitments that are the subject of these directives, those laws often end up being documents that are put in a drawer and locked away. To make major progress, society has to be on board. They have to take ownership of this battle. And this is what has taken place in Uruguay. And the outcomes achieved were based on the fact that our people were convinced that we needed to fight against this scourge, which is afflicting humanity. But as I accept this award, I am committing to continue working to control not just the tobacco epidemic, but also other major risk factors for non-communicable diseases, such as a sedentary lifestyle, unhealthy eating, and alcoholism. And all of us are committed in this fight. Ladies and gentlemen, friends, to come back to tobacco control, I would just humbly ask, how should we continue? And although it seems far away now, I have to continue working in Uruguay, and not just for institutionally formal reasons as the president of the country, if you will, but also and mainly for reasons that emerged from a statistic study which took place between December and February and was carried out by the National Statistics Institute, the Public Health Ministry of Uruguay, and the Global Adult Tobacco Survey Uruguay Committee. According to this study, whose focus was a representative sample of the entire population of the country over 15, tobacco consumption is on average around 21% of the population, 25% among men, 18% of women. This average is 4 percentile points lower than in 2009, which was 25%. And the highest impact of reduction was noted in the 15 to 24 age bracket, and more so among men than among women, which went down from 24 to 15% between 2009 and 2017. The highest percentage of consumption takes place in the 25 to 44 age bracket, 33% among men, 25% among women. 19% of those surveyed state that they have been exposed to secondhand smoking in bars, restaurants, and banquet halls, even though in our country it is absolutely forbidden to smoke in enclosed areas. 11% in workplaces and academic centers, 7% in public transport, and in homes. And please pay attention to this, because we are a country that has fought tirelessly against the scourge of tobacco. In 20% of homes, people still smoke, and we are very much hurt by this. I could give you further information, but I think that what I have given so far is more than enough to understand that we still have a lot of work ahead of us in Uruguay, and indeed in the entire world. And even more so if we bear in mind that according to that same survey, 97% of those surveyed believes that smoking is harmful to health. And nevertheless, there is still a major percentage of the population that continues smoking because of nicotine, which is a drug which is much more addictive than cocaine. But 72% of current smokers are planning to stop smoking in the short or medium term. And we have to help those who want to take that road. We have to convince the remaining 18% to also take that road, because governing also means helping people along throughout their lives. Friends, to conclude this statement before we continue, allow me to say that no matter what we do, there will always be a lot left to do, because you can always do more to promote human dignity and life for all of those of us who live on this planet. When all is said and done, beyond any one of us particularly, humanity's tropism is for human life to be worthy and of dignity, with no exception. And because no exception is valid, we cannot leave many people behind. All of us have to improve our living conditions in this world, with no exception. Because, as I said, no exception is valid, because when it comes to human life and dignity, when it comes to human rights, this is not acceptable, especially the most important right that those of us who are in this universe and world have is the right to life, life of dignity and a healthy life. And so I would thank you very much for welcoming me with so much affection. But beyond that, I would also thank you for the excellent work that you are doing on behalf of the lives of those who populate this planet. Thank you very much.
Muchas gracias, Dr. Tabaré Ramón Vázquez.
Thank you very much, Dr. Tabaré Vázquez.
We will now move quickly to our distinguished panel. I will respectfully remind our panelists we have located the acoustic signal that was used recently at the World Health Assembly Committee A. You may hear a lovely note of a bell when it is coming time to wind up your remarks. I don't think we'll have to use it. I'm confident. But may I please now invite Dr. Vera Luisa da Costa e Silva, head of the WHO Framework Convention on Tobacco Control Secretariat, for your remarks.
Good morning to all. Your Excellency, the President of Uruguay, dear DG, Svetlana, Sanya, colleagues, ambassadors and representatives from permanent missions, the President of the World Heart Federation, my dear colleagues and friends. Let me start my remarks by thanking WHO for the opportunity to join you in commemorating this important date in the annual public health calendar. I would also like to express my gratitude to Dr. Douglas Becher for having successfully led for many years WHO's Global World No Tobacco Days campaigns in coordination with WHO regional and country offices. Of course, it's also important to recognize the strong and committed team that works with Doug to make World No Tobacco Days a success every year. It is commendable that WHO member states established this date exactly 30 years ago with the aim to raise awareness about the growing consequence of tobacco use. A logical approach in line with the Alma Ata Declaration issued at the International Conference on Primary Health Care 40 years ago. It was in 1988 that Dr. Halfdan Mahler, the third WHO Director General, celebrated the first World No Tobacco Day. That very day was the first milestone on the path to raise international awareness about the vast consequences to health from tobacco. He also delivered the first awards in recognition to individuals, institutions, and governments showing exemplary leadership in tobacco control. I happen to be one of the recipients of these honors back 30 years ago, and I brought it to you, the World No Tobacco Day Award, received from WHO 30 years ago. It meant a lot to me, but also has put a lot of responsibility on me. As a young woman who was facing all odds for being involved as a public servant in this challenging new area that competed with so many other health priorities. And also to my country, Brazil, that was about to adopt a new constitution in 1988 that provided for the universal right to health with emphasis on preventive measures. This fact and the celebration of World No Tobacco Day in my own country represented not only a landmark in my career, but a motivation for an important tobacco growing developing country to secure a number of measures that have eventually halved tobacco use prevalence from 35 to 14% and impacted significantly on the mortality of Brazilians. This was also an important practical example for the discussions and decisions in future World Health Assemblies to use WHO constitutional powers to negotiate the Framework Convention on Tobacco Control, one of the most important milestones in public health and in the control of non-communicable diseases. World No Tobacco Days are the very initial step that a number of countries, especially low and middle income countries, give to express their political will towards curbing the tobacco epidemic. It raises the attention of decision and policymakers, the media and the public, to the need to act and represent an opportunity to point to the need to protect public health from the tobacco industry strategies. As we speak here, governments, intergovernmental organizations, and the civil society from Africa to Asia, from Europe to the Americas, from the Southeast Asia to the Eastern Mediterranean, are either planning, celebrating, or disseminating news about 2018 World No Tobacco Day. And they are doing it without the need to shift scarce resources from other priorities. They just do it with the existing resources, and by doing so, they show their political will and commitment to the public health of their people. As we move with the implementation of our FCTC 2030 project, I have 10 minutes. With thanks to the generous contribution of the UK and Australian government, which just confirmed the theory. From Samoa to Sierra Leone, the countries that we are supporting through FCTC 2030 are celebrating World No Tobacco Day 2018. At this point, I would like to make a balance on the actions taken so far, and of course the success stories. Two treaties, the WHO FCTC and the Protocol to Eliminate Illicit Trade, were adopted, with the first having entered into force nearly 15 years ago, and protect over 90% of the world's population. While the second has still not entered into force, we are missing just 5 countries to make it become an international treaty at its own right. Furthermore, the power of the WHO FCTC has catalyzed significant actions in the world, from plain packaging to the ban of flavors and tobacco products, from promoting alternative livelihoods to tobacco growers to address the tobacco industry liability. We have gone a long way already. Indeed, by implementing the demand and supply reduction measures in the treaty, we are reaching out to multiple players, including new stakeholders that were never involved before in the subject. We are going even beyond by identifying innovative approaches for actions such as linking tobacco to human rights, studying the impact of tobacco on the environment, and including the WHO FCTC as a target for the 2030 Sustainable Development Agenda. We have found that the WHO FCTC can support the achievement of more than 60 SDG targets. We are involving more and more sectors in the commitment to protect the present and future generations from the devastating health, social, economic, and environmental effects of tobacco use. However, while acknowledging the successes achieved so far, we have still much to do. The more we go, the more the tobacco industry aggressively reacts, not only interfering in national legislative processes, threatening or taking legal action, using front groups to promote their case, but also inundating the market with a number of new products with unverified and false claims of harm reduction. That's the reason why I will end my speech by inviting parties to the treaty and observers to the COP to attend the forthcoming 8th session of the Conference of the Parties of the WHO FCTC from 1st to 6th October 2018 in Geneva. And we would be very honored if the President Tabaré Vázquez could join us in the high-level segment of the COP. Your presence is fundamental to ensure evidence-based measures are universally implemented, that the treaty machinery is full to face new challenges and to move toward the tobacco-free world. I would also like to remind parties to the treaty that there is a protocol that needs everybody's commitment to eliminate illicit trade in tobacco products and invite you to consider becoming party to it, if possible by depositing it at the UN depository before July 2nd. Finally, I would like, on behalf of the Convention Secretariat, to thank for the opportunity. I would also wish to express my deep thanks for the hard work and commitment of my small team at the Convention Secretariat. Today is World No Tobacco Day. Let's celebrate. Thank you.
Thank you, Vera. Dr. Tedros will have a quick look to verify the certificate. It is indeed, truly, signed certificate.
By the way, I wanted to check if Mahler's name is fully put here, because his middle name is my name, Theodor. It's true. So we have one in common with former DG.
Oh, look at that. Oh. Well, we have many circles today, and we have invitations to Uruguay and invitations to Geneva. It is my pleasure now to invite Dr. Douglas Betcher to speak briefly about today's theme, tobacco and cardiovascular disease. Douglas.
Good morning, buenos dias. Good morning, buenos dias, Your Excellency, President Vázquez, ambassadors, distinguished colleagues, and first of all, happy World No Tobacco Day, and also wishing a happy 30th birthday to World No Tobacco Day, because we're also having many coincidences this year. WHO is having many birthdays, and World No Tobacco Day is also celebrating its birthday today. And I want to reiterate first, Your Excellency, President Vázquez, that you are our mentor, our guru, and a courageous tobacco control leader, and I salute you for your leadership in global tobacco control. As you saw from the opening video, which has been running on CNN for a few weeks, WHO has chosen a catchy tagline for World No Tobacco Day 2018, "Tobacco breaks your heart, choose health, not tobacco," so that we can reach our stakeholders, but also more importantly as well to reach the public with our key messages. And I was glad also when I spoke with Dr. Tedros earlier that he really liked that theme, "Tobacco breaks your heart." The theme complements WHO's vision, mission to promote health, keep the world safe, and serve the vulnerable. And it's just completely unacceptable that the 7 million people that die every year, which means 19,000 needless deaths from tobacco use and secondhand smoke, can be completely prevented. And most of these deaths occur in low and middle-income countries. The bottom line, tobacco kills. And 1 in 3 deaths worldwide is caused by cardiovascular disease, despite the availability of effective, inexpensive, and safe treatments. In fact, cardiovascular disease is the world's leading cause of death, killing around 18 million people every year, with over 80% of these deaths occurring in low and middle-income countries. Tobacco use and secondhand smoke exposure are major causes of cardiovascular diseases, contributing to approximately 17% of all cardiovascular disease deaths globally, about 3 million deaths per year. And you might ask, how does tobacco break hearts? Well, simply and toxically. First of all, tobacco smoke contains over 7,000 noxious and deadly chemicals, including tar, which damages blood vessels, disrupts regulation of blood lipids, and thickens the blood. Tobacco also contains nicotine, a highly addictive substance associated with increases in heart rate, blood pressure, and myocardial contractility. Smoke also contains the poisonous gas carbon monoxide, which replaces oxygen in the blood, thereby reducing the availability of oxygen for the heart, muscle, and other body tissues. All tobacco products are inherently harmful, including smokeless tobacco and heated tobacco products. You might think that most people know about tobacco, that tobacco damages your heart. And you would be partly correct, but only partly. Most people are aware of tobacco use, and it increases the risk of cancer, but there are gaps in knowledge of the cardiovascular disease risks of tobacco use. And in many countries, these knowledge gaps are substantial. We've learned a lot about this from our Centers for Disease Control, WHO, global adult tobacco surveys, which show, for example, the percentage of adults that do not believe that smoking causes stroke ranges as high as 73% in China. For heart attacks, for example, 61% of adults in China were not aware that smoking increases the risk. With this World No Tobacco Day theme, we aim to close this unacceptable gap, and we are happy to have the World Heart Federation as a partner, who can help us not only to reach cardiologists and GPs around the world, but also the general public. And of utmost importance, the benefits of quitting are the best gift tobacco users can give themselves. The benefits of quitting tobacco use are substantial. WHO recommends brief advice, use of counseling through toll-free quit lines, and/or mobile text messages through our cessation programs that we're scaling up in countries, and the most effective solutions to help tobacco users to quit. Some examples of the benefits of cessation start almost immediately. Within 20 minutes, the heart rate and blood pressure drop. Within 12 hours, the carbon monoxide level in blood drops to normal. Between 2 and 12 weeks, the circulation improves and lung function increases. 1 year after quitting smoking, the risk of coronary heart disease is almost half of that of a smoker. Between 5 and 15 years after quitting smoking, the risk of stroke is reduced to that of a non-smoker, and 15 years after quitting smoking, the risk of coronary heart disease is that of a person who never smoked. And as Dr. Tedros emphasized, tobacco is one of the greatest public health and development threats the world has ever faced, and that's why tobacco control is well reflected in the Sustainable Development Goals and related targets. In order to reach the Sustainable Development 3.4 target to reduce by 1/3 premature deaths from NCDs, we will need to substantively reduce tobacco use in countries, and also, as Vera had mentioned, to substantially strengthen the implementation of the WHO Framework Convention on Tobacco Control. Also, with this World No Tobacco Day, we've launched a new report on trends in tobacco use. Using data from countries, we estimate trends in each country and summarize these at global and regional levels. And as Dr. Tedros mentioned, after the high-level meeting, heads of state meeting at the UN General Assembly in 2011, one of the pieces of homework from WHO were for us to develop targets and to have those accepted by our World Health Assembly. One of those targets was a 30% relative reduction of tobacco use between 2010 and 2025. And likewise, in the 13th Global Program of Work, there is a target which is consistent with moving forward this target and accelerating this target over the next 5 years during the 5-year life of the GPW. And today's report that we've launched, it shows that worldwide, in fact, 27% of the world's population smoked in 2000 versus 20% in 2016. So while tobacco use rates are declining globally, Progress is not even. High-income countries are making faster progress than low- and middle-income countries. Only 1 in 8 countries is on track to meet the voluntary global target to reduce tobacco use. And as Dr. Da Costa de Silva so eloquently discussed, the Framework Convention on Tobacco Control provides a strong, concerted response to the global tobacco epidemic. And thank you, Vera. To support governments in strengthening the prevention and control of cardiovascular diseases, WHO and the United States Centers for Disease Control and Prevention launched the Global Hearts Initiative, comprising 3 technical packages, which are shown on this slide. Comprising the Empower package, which lies at the heart, no pun intended, of the WHO Framework Convention on Tobacco Control demand reduction measures. Also the Shake package for salt reduction, and the Hearts package, which my colleague Goike is going to elaborate on, I'm sure, in more detail in the next presentation. So combined, these packages provide a set of high-impact, evidence-based interventions that, when used together, will have a major impact in improving global heart health and making an impact on the ground where it counts, and that is the top priority of the global program of work and Dr. Tedros's priority to make sure that WHO is making an impact at country level. So today, on World No Tobacco Day, we call on everybody to fight against tobacco, national governments, local governments, cities, civil society, all healthcare providers, general practitioners, doctors and cardiologists. We say at WHO, make every day World No Tobacco Day, and happy World No Tobacco Day 30th anniversary. Thank you.
Thank you, Douglas. As you alluded, we now turn to Professor David Wood, President of the World Heart Federation, to help us understand a little bit more about what general practitioners and cardiologists can do.
Thank you, President Vázquez, Dr. Tedros, and distinguished guests. It is a privilege for the World Heart Federation to join you on World No Tobacco Day. And the heart of the matter of non-communicable diseases is, of course, cardiovascular disease, heart attacks, and strokes. And the mission of the World Heart Federation is to make cardiovascular health a universal human right. Advice to stop smoking and providing professional support to do so is the single most important intervention a physician like President Vázquez, or a cardiologist, or a general practitioner, a nurse, a community health worker can offer. And it is simple to do. Firstly, we need to ask, and then we need to advise, and finally we need to act. Ask, first of all, are you using any form of tobacco products, either now or in the recent past? Secondly, advise to quit smoking or using any form of tobacco completely. You must stop smoking or it will kill you is not the most helpful behavioral approach, because many patients know the risks associated with smoking. Many are willing to make a quit attempt. And so it's more appropriate to say, can I offer you help to stop smoking completely? And finally, to act, to provide behavioral counseling and support on approaches to stopping smoking, including the use of evidence-based pharmacotherapies, nicotine replacement therapy, and centrally acting drugs such as bupropion and varenicline, which can halve quit rates, and finally to provide follow-up and reinforcement for patients who relapse, to try again, to build on their initial success. And if you're interested in more information on how you can support patients to stop smoking and to reduce smoking in the population at large, the World Heart Federation has published fact sheets on its website for both the patients and the public. Why is advice to stop smoking the single most important intervention that we as health professionals can offer to our patients? Number one, it saves lives. It improves longevity. Secondly, it reduces the risks of another heart attack or stroke and other smoking-related diseases. It also reduces the need for rehospitalization, expensive medical interventions, revascularization procedures, and so on. And finally, it is cost-effective and ultimately cost-saving for the health service. But as we physicians and health workers struggle with our patients to help break the addiction of tobacco, we need a public health context in which to make our work easier. And that is why public legislation on tobacco control and the inspirational work of President Vázquez is so important to the work of cardiologists and physicians like ourselves. The public health agenda is the single most important step towards smoking cessation in the population at large, but we can play our part for our patients as well. Thank you.
Thank you, Professor Wood. I'd like to invite our colleague, Dr. Gojka Roglic, to speak about the Global Hearts Initiative. Dr. Roglic.
Thank you, and good afternoon, Your Excellency, President of Uruguay, Dr. Tedros, Excellencies present here in this room, dear colleagues and guests. I will give you a few slides on the Global Hearts Initiative. As we have heard, almost 18 million people are annually die of cardiovascular disease. Well, what is more important is that a high proportion of these deaths is premature. We all have to die eventually, and maybe cardiovascular disease is not the worst way to go, but we first want to celebrate our 95th birthday. Tobacco is a heartbreaker. There are other heartbreakers. Unhealthy diet leading to high blood pressure, physical inactivity also leading to obesity and high blood pressure. So the Global Hearts Initiative is a composition of three technical packages aimed at reducing premature mortality of cardiovascular disease. The Empower has a technical package on tobacco reduction use has been mentioned. SHAKE is a technical package to assist. It's a policy intervention to reduce salt consumption, and HEARTS is a technical package for management of cardiovascular risk in the population. The technical package, HEARTS, includes several modules, from a behavioral lifestyle changing counseling module, evidence-based treatment protocol to manage cardiovascular risk, a module to facilitate and improve access to essential medicines and technology, a module on team-based care where task shifting is important and where lessons have been learned from the HIV approach, and also a module to help countries introduce systems for monitoring. So HEART is being implemented in these countries. They are present, the countries are distributed throughout the world in all WHO regions. There is certainly place here to include Uruguay as well. And in the background, the dark areas, which are not really seen very well, show that most of the world has a prevalence of hypertension between 25 and 35%. The countries that have started implementing the Global Hearts Initiative, which is a relatively new initiative, have already had treatment protocols adapted. Monitoring systems are now being introduced. There is ongoing capacity building of healthcare staff, and task sharing has been introduced on the model of the experience with HIV and AIDS. And so far, what has been learned and the experiences are that primary care strengthening is essential to advance cardiovascular disease prevention and control. Evidence-based protocols can reduce treatment variation. Task sharing and shifting is essential to achieve coverage and improve compliance. And simple monitoring systems with simple indicators such as control of hypertension can inform the program to introduce changes. And cardiovascular disease prevention interventions are to be part of the universal health care packages. Thank you.
Thank you, Dr. Roglic. We now have some time to take some questions, comments from the floor. Before we do that, I just wanted to share briefly how special it is for me also to be a part of this. I came into the organization in the area of tobacco control, Tobacco-Free Initiative, as it was called at that time, and listening to His Excellency speak with such passion about working in this area and how important it is to fight the forces that are working every day to keep it in the world, reminded me that once you have worked in this area, it stays with you. It is something that you do and you feel for the rest of your life, I think. But it's my great pleasure to be with you today as we celebrate World No Tobacco Day. And now, does anyone have a burning question for our panelists? I would encourage you to think of questions and not comments. And if you do have a comment, to keep it brief if we can. I'd invite our colleague, Excellency from Brazil, and I did see Ecuador. Please.
Thank you, Mr. Moderator. Bueno, primero quería...
First, I would like to say to President Vázquez that I lived in your country for 5 years, and the first time was in Boulevard Espeña, and then in front of the La Rambla at the beach. And I was very happy living there with my family. So I recommend to all of you to visit Uruguay. Well, President, I would like to congratulate you for your leadership in this extraordinary fight against tobacco. To be very brief, I would like to recall that Brazil also played an important role because we shared with two negotiators the negotiation of the convention, and we have a Brazilian who is the very enthusiastic leader of the fight against tobacco here in the WHO secretariat. In Brazil, cardiovascular disease is the main cause of death among smokers. We have made major progress in our national policy to control tobacco. What we have seen is a major drop in the number of smokers over the past decade. Some of the measures have been mentioned, tax measures, creating no smoking places, and we've also used health warnings on cigarette packages. Implementation of the Framework Convention has played a huge role in creating these measures, and I would just inform this Director General that the President of Brazil said that Brazil would accede to the protocol for the elimination of illegal trade in tobacco products. And so soon we will be part of the countries that have signed and deposited their signatures for this instrument. And I would just once again reassure you of our commitment to the fight against tobacco. Thank you very much. And President, congratulations.
Thank you, representative of Brazil. And the representative of Ecuador, please, you have the floor.
Señor Presidente.
President, Director General, it is an honor for Ecuador to be here today to witness this award being given to the President of Uruguay for the practice that he has undertaken to lead the fight against tobacco in the health arena. Ecuador was present. I was the representative for Ecuador in New York when this convention was being debated, and so I just have to say that we were there together because he was there was the Uruguayan ambassador, and I think that anyone who goes to Uruguay will see that it is very warm and friendly. I would just like to say on behalf of the delegation of Ecuador that we congratulate you and that you can count on our full support and help in going forward. Thank you very much.
I see a hand up. Did anyone have a question to pose to our learned panel? Dr. Maria Nera.
Muchas gracias y gracias, señor presidente, por.
Thank you very much, and thank you very much, President, for making Spanish so present. I'm very happy. I know that your name is Ramon, but I know for many of us in public health you should be called David because you are a sort of David against Goliath. And for those of us who work constantly in public health every day, we would like to say that you are David who won against Goliath. What I would like to know is what can people in your same position, those who are presidents, do not see this as the same priority for public health and do not see the electoral possibility of promoting these measures. What is the distinguishing factor? Do you have to be a doctor and a president? What is the reason that they don't see this as being such an important subject, such as, for example, air pollution, which is also another issue where we're going to have to work? Thank you very much, and once again, congratulations.
agradezco a todos ustedes.
Thank you all once again, those of you who have spoken in acknowledging the work that our people have done, because it really was done by all of Uruguay. I would just say that perseverance and our insistence in putting forward such an important public health problem for the community is the key to make more and more governments come on board to the fight against this scourge that is tobacco, and also to set up lines for our work to overcome non-communicable diseases. I think that in a work of this, in a job, in a challenge of this breadth, I think that we have to focus on communication and information, targeting society and people in our countries. They are the ones who lobby policymakers in order to implement particular agendas in order to fight against these illnesses. And I'm speaking not just as a doctor, but also as a politician. Politicians are very sensitive to public opinion. So what we have to do, those of us who are working in the medical field, or you who are working in the public eye and international public health, is to target public opinion. You have to reach people. You have to explain to them simply but clearly what the problem is, because many people are unaware. They do not understand the dimensions or the seriousness of smoking and the impact that that has on their health. And people, the common denominators, are also the source of politicians. You don't have to be a doctor to work in this area, but I think that the most important tool to fight against these scourges is education and informing the population. All of the efforts that we can make to inform people would be worthwhile, and we would have a real partner in encouraging public policymakers to fight against this scourge and to put all of the tools at their disposal forward. Also, the possibility of humanitarian action, because many of us are sad when we see that people are dying or getting sick because of these diseases or because of smoking. I think that that is something that we can all appreciate as leaders, but I think that we also have to appreciate the economic aspect that is behind all of these diseases. In many countries throughout the world, governments started to pay more attention to the fight against tobacco when their ministries of economy realized that they could get a lot of money by taxing tobacco, but they would also have to invest less in the fight against the illnesses and disabilities caused by smoking. And so the economic aspect is key. If you combine that with the humanitarian aspect, it would lead to many countries taking very clear-cut decisions against tobacco. Another very obvious example would be what has happened in airlines. Commercial airlines, commercial passenger flights. I remembered people said that if I am not allowed to smoke in a 12-hour flight, well, I will not fly. Well, they forbade smoking and nothing happened. There was no drop in passengers. So I think that that is quite noteworthy. I think that education and information is the main tool that we can use to fight against this scourge, in conclusion.
Thank you, Your Excellency. I think there was a question over here. Yes, please go ahead.
Thank you. My name is Kate Robertson. I'm a legal consultant working with Dr. Douglas Betcher at WHO. And firstly, thank you to all of the panel for such wonderful input. My question is to the President of Uruguay. Your Excellency, Uruguay is such a shiny example of fighting against the tobacco giants. I'm wondering if you could tell us a little bit about the proceedings against Philip Morris and how it is that you won that battle.
Thank you. A not surprising question coming from a legal frame of reference. Your Excellency, we're taking full benefit of your presence here today. Please.
Sí. Con respecto al pleito internacional.
Regarding the international lawsuit lodged by Philip Morris against Uruguay, given their tort claims, their commercial tort claims, it was a World Bank court which judged the matter, which deals with private matters, but also private matters involving a state. This was the case of Philip Morris when it decided to sue Uruguay. This trial happened more or less in two stages. Firstly, one that was between the plaintiff and the defendant in Paris, where the concept about the commercial interest was determinant as to whether the trial could move forward, whether Philip Morris's commercial interests were damaged. That was the claim from Philip Morris. They said that Uruguay and Switzerland, because we have our bilateral trade agreement, which protects interests, and because because this had taken place in Switzerland, and they were saying that we were breaching our bilateral investment treaty. Uruguay responded that commercial interests always have to be subordinated to the interest of protecting the health and well-being of its people. A country not only has the right to defend the health of its people, but rather the obligation to do so. And ISADE, which was the World Bank Court, allowed for complaints, or rather briefs and arguments, to be submitted that had never been submitted before, including information from the WHO, which showed all of the problematic aspects of tobacco consumption. And then at the second stage, the court ruled entirely in favor of Uruguay. And I think that that was a major milestone for all governments, really. Namely, that based on this verdict, in new investment protection treaties, there is a clause included which says that countries have the right to defend the health of their peoples over trade law. And that was a precedent that was set internationally. I think that from a global standpoint, that was the most important achievement made. Not just showing the world that you can fight against organizations and industries that are as massive as the tobacco industry, but also you can move forward in protecting the health of our people. From my modest point of view, this was the most important achievement that was made in this Philip Morris trial.
Thank you very much, Your Excellency, for these insights that may not be known to everyone in the room in how this was done. It is now my pleasure to invite Dr. Svetlana Axelrod, the Assistant Director General for Non-Communicable Diseases and Mental Health, to provide a quick wrap-up for us. And after that, if I can just ask you to stay seated, we will be doing a quick photo with the panelists, with His Excellency the President of Uruguay, Dr. Tedros. And if I can just ask your patience to stay seated for that photo, and then they will make their way from the room. Thank you.
Very much. Good afternoon, Your Excellency, President Vázquez, and distinguished guests and colleagues, Dr. Tedros. Thank you for attending this important lunchtime event today that marks the 30th celebration of World No Tobacco Day. And I would like, first of all, congratulate His Excellency President Dr. Tabaré Ramón Vázquez, President of Uruguay, on his receipt of the Directors General Special Recognition Award on the contribution to global tobacco control. The award is testimony of our appreciation to President Vázquez's leadership and achievements in scaling up tobacco control efforts into the broader agenda of the Global Action Plan for the Prevention and Control NCDs, as well as the 2030 Agenda for Sustainable Development Goals. In the fight against NCDs, Uruguay's tobacco control experience has accumulated invaluable lessons learned. These lessons must be capitalized in many more countries across the world, and we also need to translate them into approaches that will speed progress in tackling other NCDs risk factors. Our panelists today have touched on some of the most important questions on NCDs prevention and control. And this is how we can effectively tackle tobacco as the major risk factor for cardiovascular diseases. How we can make sure that everybody knows about the danger of tobacco. How we can support countries in effectively countering interferences, attempts by the tobacco industry. How we can protect the most vulnerable populations in low and middle income countries from the growing epidemic of NCDs. And how we can help countries to raise domestic resources, for example, through tobacco taxation, so that can make sure that communities have successful financial means for needed health services. There are so many important questions that need doable and proven solutions that I thank all speakers and panelists for shedding light on what we can do to go forward. And tomorrow we will have the launch of the report of the WHO Independent High-Level Commission on NCDs. And it will provide us further opportunities for strategic directions, how we have go ahead. I am inviting all of you tomorrow to attend this important launch event. We will also have this distinguished guest and His Excellency President Tabaré tomorrow. And now I would like to invite you all to go to the reception, and thank you very much for attending this event.